here we are. This is Sex Love Psychedelics, and I'm your host, Dr. Kat, bringing you psychosexual conversations that will leave you intellectually turned on and hungry for more.
And so that brings up a question for me too, the concept of hormone therapy, because I grew up, put them on the pill, put them on, the Ovaring. Was it the Ovaring? I don't know.
Ring,
But
yeah.
these types of hormones. But then we also talk about hormone therapy as it relates to perimenopause symptoms and hormone therapy as it relates to imbalance in your endocrine system. So can you help us to understand what the stigma of hormone therapy and where it's supportive for us, or where the types that might be more effective? I don't know.
I mean, that's a huge question to unpack. I mean, when we talk about hormone therapy related to perimenopause and menopause, what we're talking about is trying to replenish what we're losing or mitigate those crazy fluctuations that I was talking about earlier,
Got
right?
it.
So there's kind of two buckets that we're looking at: symptom management, whether it's hot flashes, sleep, issues, mood, all the different things we talked about, right? Very, very effective, gold standard. There are other things you can use, whether it's herbal therapies, cognitive behavioral therapy, yoga, other pharmaceuticals. There's things you can do. And I think it depends on how severe your symptoms are. And again, being presented an array of options so that you are really getting informed consent, because informed consent is not present if you don't have all the information. But there's also some long-term health benefits to using hormone replacement therapy, specifically estrogen. I know there's controversy around its impact on dementia, brain function, and heart disease. Truthfully, I think the data is quite robust. There's no consensus on whether or not we're actually reducing risk, but I think people need to know that the data is robust. There's zero controversy around osteoporosis and osteoporotic fractures, hip fractures, fractures of the spine, which, like 1 in 2 women may end up with osteoporosis later in life, and problems like frailty, health span, metabolic health. So I think we need to be looking at hormone therapy is part of lifestyle modification, diet, stress, nutrition, weight-bearing activities, strength training, all those things. Hormone therapy can and should be part of that. And it's much safer than most people realize, and it's much safer for most people than most people realize. Again, not here to tell you what to do, but I think the fact that we went from 40-something% to 4%, and actually breast cancer has not been reduced, dementia has not been reduced, heart disease has not been reduced. So I don't think we help women by taking hormones away. That's not what the evidence seems to indicate. So just knowing it's all part of a program, and just having those options. I mean, talking about hormones in your younger years, I'd love to come back and talk about it, because birth control, contraception, not controlling, bodily autonomy around your cycle, pain management, really important topics, and they have an impact on our self-awareness, our body awareness, and our sexual health. And I think painting everything with like birth control pills are terrible, you're going to make the wrong partner choice. I mean, it's a little more complicated than that.
Yeah.
Yeah.
I get those questions all the time. Oh, I've been on the pill for a really long time. If I come off, am I not going to want my partner anymore? And while there is an aspect of it as it relates to the hormones, there's also so many other factors that are at play too. Yeah.
Right. Yeah. But that boils us down to like, we're only hormones. I mean, that's absurd.
Oh, yeah.
We're more than our hormones. So
yeah. I would hope so.
But people don't always hear, again, there's so much confusion and there's so much noise and there's not enough data, and people have strong opinions. I'm not saying I don't. I have strong opinions too. And I think if you look at your job, you said it, we're educators. Like, we're here to educate and to support. I'm not here to voice my opinion on anybody. I know things that you don't know. I've been practicing medicine for 25 years, and I spent 12 years getting to where I was. And still, by the way, 12 years in, you're like, what the hell are you doing? 25 years in, I'm like, oh, that's new. Never saw that before still. And I pretty much know what I'm doing. So I want to offer that knowledge and then help guide and support people through the process that they need.
Yeah.
that they determine.
And that's such a great, when I look to the people that, the experts that I follow, it's the ones that know that are, have the wisdom from the years of practice and are still open to the flexibility of new information coming in and challenging how they've been seeing something or like perceptions of something. And I think that's a lost art in this world right now.
Well, curiosity and humility. We need curiosity and humility need a comeback, you know? Yeah, I mean, we're out there, and that I feel the same way. That's who I'm attracted to also. I want to have a conversation. I want to hear. I want to learn. Look, I wrote my book. When you write a book, you write it, you sell it, you publish it. It's by the time you write it and sell it, it's 2 years. Okay, so I wrote my book. I'm a breast cancer survivor. I was like, never would I ever I'll use vaginal hormones. I use them, but I don't use systemic. It's not safe. Well, guess who uses systemic hormones now? Me, because the data changed. I read it and I changed my mind.
Yeah. Oof. Yes. I love that. So staying on top of the new information, staying on top of new experiences, listening to our clients, listening to our patients. I learn so much from them all the time, and I've been doing
our biggest teachers are our clients and patients.
Yeah. I've been doing this 15 years and I still learn something new all the time.
Yes.
Well, that was fun. Thanks for tuning in, lovers. And if you want to experience more ecstasy and sexual liberation, head over to sexlovepsychedelics.com and learn about how you can join me for any one of my online or live events. And while you're there, grab my free guide on sex and psychedelics. Remember, this podcast is for entertainment and educational purposes only. Please contact your healthcare provider and local law before pursuing any of the products or psychedelics discussed. And one final note here. I make this show specifically for you. If you're loving the show, then be sure to leave me a review in iTunes or Spotify to let me know. Happy to be here and happy to serve. I'll see you next time on Sex, Love, Psychedelics.